Hello, my name is Kate Carr-Fanning and I'm the Vice Chair of the Adhd Ireland, and I am also a trainee psychologist finishing off my PhD in the School of Education in Trinity College Dublin, where I'm specialising in inclusive education for ADHD. So I'm using my own personal experiences and my psychological knowledge to develop more inclusive and supportive environments for teachers and for students with ADHD. So today I'm going to talk to you about an IEP. If we think of an IEP, stands for Individualised Education Plan. So we talk about what it is, why it's important to have an IEP for students with ADHD, and we're going to talk about the process of planning, writing, implementing and reviewing. But we're going to spend an awful lot of time in the planning and talking about the types of special education needs you should expect to find in populations of students with ADHD. So an IEP is a process. It's an individualised collaborative process which includes 4 different parts, which is the planning, the write-up, the implementation and the review. If we think of the IEP as a process, the product of that process is the actual written plan. So why would you need to have an IEP for students with ADHD? Well, first and foremost, it is recommended under legislation. And it is recommended by a number of different agencies like the National Council for Special Education and the National Educational Psychological Services, both of which have developed guidelines for their implementation and the development, and you can download them for free on their websites. Adhd also has included recommendations for IEPs in our free teacher's guide, which you can download for free on our website. So why have an IEP for students with ADHD? Well, first and foremost, inclusion is about individualised education. If you get a diagnosis of ADHD, you'll often get a medical label. That will provide you with an awful lot of information, but it's not going to tell you about the whole child, their strengths, their needs and their abilities, and also the problems and solutions that are available within their own environment. So you as a teacher are in a very privileged position that you can actually get to know the child behind the label and what their specific learning needs are and how you can work together to overcome them. So an IEP is a holistic approach. It's also proactive. One of the reasons why teachers in schools are often reluctant to do an IEP is because it's time consuming, and it is at the beginning stages. But if you think of that in the context of you're actually nipping something in the bud, and so down the road, say 6 months, a year, 2 years, you're not going to be dealing with as complex difficulties. So this is a really sort of preventative approach. It provides structure, and the golden rule when it comes to educating students with ADHD is to provide as much organisation and structure as you possibly can. This is particularly true when it comes to students in second level, when IEP development is much more difficult because there's lots more teachers involved, a lot more subjects, a lot different demands. But this is also the stage when an awful lot of students with ADHD really start to struggle. ADHD is what we call an executive function disorder. So this means that higher cognitive abilities like planning, organisation, time management are going to be a real struggle for them. If you have an IEP, that means that there is a written document that goes across all the classes with the students. All the teachers are able to provide a similar structure and understand that child's needs. And this is so important when it comes to a student with ADHD, for everybody to be on the same page, working together and providing similar supports. Finally, a difficulty that a lot of students with ADHD will have is that they will have experienced repeated failures, rejection and exclusion, which will leave them feeling very disengaged from their education and also with very low self-esteem. If you include a student from very, very early on in the development process, and they really should be one of the key, as the key stakeholder, they should be one of the ones who are included. If you include them from early on, this is going to increase their sense of engagement with their own education. And as they watch themselves achieve their goals, this is going to increase their self-esteem. And for the first time possibly begin to experience success and as if somebody cares about them. And this is often why students with ADHD will disengage from the educational experience. Now, I mentioned collaboration before. And this is when it comes to any student with special education needs, and particularly ADHD, because they need that structure and that communication. We need to come together. Everybody has a little piece of the solution, and only together can we actually solve the problem. The principal technically decides who is on the IEP review board. He will identify somebody within the school who will be the IEP coordinator. So they will organize all the planning, they will do the interviewing, and sometimes they will be the one who actually write the report, or sometimes you can come together and have a planning committee and actually write up the report. It's really going to depend on your school and how things are going to work for you. Other important persons to be included are the parent and the student are absolutely vital. In another video in this series, you will hear a very, very eloquent young man speaking about his experiences at school. And it is so important to include these young people themselves because ultimately it is them who is going to have to manage their ADHD. This is something that you have, it's a lifespan condition, it's something they will have for the rest of their lives. You could be instrumental in teaching them those skills. Again, as I said, special education need coordinator, the teacher or teachers as appropriate, other school staff, perhaps the SNA or a resource teacher might like to be involved. And as I said, parents, teachers, and then also external professionals such as a psychologist. So I'd like to move on to the first stage, and the stage we're going to spend probably the most time on, and this is the planning stage. So the planning phase should really be sort of step one of the IEP process. And this is where you're going to want to gather as much information from as many sources and as many different people as you possibly can. I'm going to point you in the right direction of some of the things that you should be aware of when it comes to a student with ADHD. As I said in the beginning, often when you have a child sitting in front of you with ADHD, you just know that that child has a particular label and some of the behaviours or the symptoms that will go along with it, as well as some recommendations for strategies that you can use. And all of that is really, really helpful and important information. Some of the things that we forget to consider are the student factors. Most importantly, their strengths. An IEP has to be a strength-based process, so you have to look for their strengths first. What is a student good at? What skills, what coping mechanisms do they already have? The student and the parent are going to be the best sources of information about this. The second thing you're going to want to look at is the functional difficulties that they have. As I said, ADHD is an executive function disorder. So think about their planning skills, their organization skills, their social skills. Maybe they lack self-awareness. Maybe they have a very high level of self-awareness. These are all things that you need to think of and consider. Another important thing to consider is that ADHD tends to come with one or more comorbid or coexisting disorders. So this will be learning disorders like dyslexia and also psychiatric conditions like depression and anxiety. Remember that ADHD is associated with challenging behavior, but sometimes that behavior is externalized, which means that it's turned outwards and it becomes aggression and disruptive behavior in a class. About half the time it becomes internalized, which means that they become very anxious, very depressed, and very withdrawn. Both of these behaviors are difficult and need to be addressed within the IEP. The student's feelings and beliefs are very, very important to also consider. Does the student feel like they can trust teachers? Does the student feel like they can succeed and like it's worth trying? Because that will really come into play in the IEP process. And then you have to move on to consider the social and environmental factors. And think about the social and environmental factors as problems and also possible solutions. So think about the resources and supports that they currently get. How are these working? What are they doing? Another important thing to consider is what resources and supports have they had in the past and what worked in the past. Previous teachers and the parent and the student are going to be the best source of information about this. It's also important to consider the days of the week and the times of the day. Students with ADHD will often have great difficulty going to sleep at night due to racing thoughts and other difficulties, which means they can often be very tired in the first thing in the morning. Some students with ADHD will be on medication, which means that it can wear off in the later afternoon, and so controlling their behavior at that stage is going to be a little bit more difficult for them. Also think about the settings. So for example, students with ADHD will find it very difficult to process a lot of different stimuli. So there's a lot of noise, a lot of people, lights and things like that going on. It's going to be very difficult and overwhelming for them. So they like a calm and structured environment. Another thing to think about is the curriculum and the instructional. So the how and what is being taught. They might have a comorbid difficulty with dyslexia. So they're going to have difficulty at times with reading. Sometimes students with ADHD have an awful hard time sitting still and listening to one auditory stream of information. So you're going to need to break up the lessons into smaller, more manageable chunks, or else they're going to get lost. We also need to think about the expectations that we're setting for students with ADHD. Sometimes asking a student to sit still for 50 minutes is perfectly reasonable. Sometimes asking a student with ADHD to sit still for 30 minutes is asking for the moon. So we need to start asking, is this expectations we're setting for all students and for ADHD fair? Because there's a difference between being fair and being equal. Being fair is everybody getting the same, being equal is everybody getting the exact same amount. But being fair is everybody getting what they need. And that's what inclusive education is all about. Another thing you need to think about is the home and community factors. Students with ADHD is an incredibly heritable condition. So the chances are that one or more persons in the family also have ADHD, which can lead to a very interesting home life, but it can also be chaotic and make things like organization and homework a little bit more difficult for them to manage. Another area to consider is their peer relationships. Students with ADHD can often be very successful with their friends. However, sometimes they can have difficulties in social situations and are more often likely to be bullied. So once you've collected all of this information, you want to start thinking about writing and implementing the plan. So if you've gathered all the data, you should be able to first identify their strengths, what their learning needs are, and then also supports and resources that will help them to overcome those learning needs. So the best thing to do is to start out with about 2 to 4 learning priorities. And we're talking about students with ADHD. Learning can be academic, it can be to do with their achievement, which would be in terms of their exam results, their academic performance, such as bringing their materials to class on time, and also in terms of attainment. So that would be studying, that would be sort of understanding the actual content. And then you're also going to have the needs that are social, emotional, or behavioral in nature. And all of these are learning and educational factors, and very, very important in the whole child education. So it's important to set, if you set, say, 2 to 4 long-term goals, we call these learning priorities. So let's take, for example, a learning priority might be Mary brings her homework to class, completed and on time. That would be a long-term goal. Now, you're going to need to set some short-term goals in order to ensure that this is achievable. Now, the Special Education Support Services advocate the SMART model. So that's SMART for setting goals. So first of all, a goal needs to be specific and objective. So not disrupting class is not really very good, and is not a very good specific goal, because disruptive is too subjective. It's also helpful to be more positive and performance oriented. So instead of saying Mary will not be cheeky, you could change it to Mary will accept correction when given it and ask for permission to express their point of view. So this is also measurable, because you can record how many times the child or the student does and does not perform the specific behavior. Goals need to be achievable and they need to be realistic. Otherwise, we're just setting the student up for failure. It's very important to start small, to go slow, and to build on existing skills. And finally, it's important to identify a timeline. So how will you know that the student has achieved the goal, and in what time frame they will achieve that? Finally, everybody needs to agree on the goals, because if the student is not on board and hasn't agreed, they will not buy in to and be motivated towards achieving these goals. So once you have set these goals, it's important to identify the specific strategies, supports and resources which will help you to achieve those goals. So if the learning priorities, Mary will hand in her homework on time, it's good to set a couple of smaller short-term and long-term goals. So you maybe would say, Mary will remember to write down her homework. She will complete her homework during her study periods, and she will ask her resource teacher for help when she has difficulty understanding any of her assignments. So those would be your learning targets. Those would be both short-term and long-term goals. So finally, we're going to get the strategies and the resource teachers. The strategies and the resources. So this is going to also include the roles and responsibilities for people involved. So you might say the classroom teacher will write down the homework assignment on the board and provide enough time for students to copy it into their homework. Maybe Mary's resource teacher will provide an assignment checklist and ensure that Mary has completed her checklist every week. The checklist could also be signed by the parent, and then everybody could agree to give Mary praise and reinforcement in order to achieve her goals. Now you can stage this out. Maybe in the beginning you might want to have the checklist checked by everybody once every week. Possibly change it to once every 2 weeks and once every month. And you can take a staged approach as Mary starts to develop and learn and internalize those skills. But then again, there are going to be things that Mary will always need to have help with. Students with ADHD often have difficulty with memory. So having the homework written down on the board might be something that Mary will need until at the end of her school career. So it's important then, once you have written up and implemented the plan and everybody knows what their role and responsibilities are, is to have a timeline for review. An IEP should ideally have a shelf life of no more than 1 year, and it should be periodically reviewed throughout that year. Thank you for your attention. We've gone through the IEP process here today. We've talked about planning, spent a lot of time on gathering information, discussed setting some goals, writing up the plan, implementing it, and also reviewing it. You should stay tuned for other aspects of our social media campaign, where there'll be a lot more information and resources. We've also updated our website, so there's a lot of good information on there. You can go to www.hadd.ie or contact HAD on info@hadd.ie, or why not call our helpline on 01 874 8349. Thank you for your attention.